My name is Dr. Drew Duquette. I'm a practicing functional medicine clinician in Illinois, and I've been in practice of functional medicine for the last 15 years. Functional medicine is a relatively new member on the healthcare block. And what makes it different than conventional medicine is this. Conventional medicine uses medications and procedures, such as surgical procedures, to manage the symptoms of a chronic problem, or just manage the symptoms of a problem. Functional medicine does not treat conditions. Functional medicine does not treat symptoms. What functional medicine does treat are the underlying reasons why you have those. And if you're watching this video, or you're any one of the number of tens of thousands of people suffering from chronic disease, it is not one cause creating one condition. You've got multiple things coming in. That's why we do broad-based testing on everybody that comes in our office to find out what are all the roots that are contributing to this patient's particular conditions. If you take a linear approach and say, as somebody comes into my office with their symptom is migraine headaches, chronic migraine headaches, I could give them magnesium, I give them riboflavin, and say, call me in 6 weeks and let me know if your headaches are better. Well, even if they were better, it doesn't mean you've answered the question. Why were you magnesium deficient? Why were you riboflavin deficient? Let's find that out so that we can resolve the problem and resolve any other potentially looming conditions that are coming down the road because we haven't addressed the underlying roots. What I'm finding now is that chronic conditions with patients are getting younger and younger, and they're getting their chronic diseases earlier and earlier in life. And some of the protocols, some of the treatments that we used to use back 10, 15 years ago no longer work. Why? Because our environment is getting worse. The foods we eat are getting worse. The stress we're under is a lot more. It's more than our bodies can handle, and they tend to break down a lot sooner than they did. The conditions I was seeing when people in their 40s and 50s, I'm now seeing in their 20s and 30s. And if that pattern continues, it'll be in their teens and 20s in the future. Chronic disease is on the rise because everything around us is getting worse. Our food supplies are getting worse, what we eat, our stress levels, it's all getting bad. So now's the time to address the underlying cause. Medications will only kick that medical can down the road and give you temporary relief of the symptoms. Eventually, there's going to come a time where the medications are not going to work, and your doctor or your prescriber is going to throw up his hands and say, there's nothing more we can do for you. And he's right, there isn't anything more they can do. Then you've got to look, now I've got to get serious and find the answers to this. And if you have a chronic problem, don't listen to anybody if they say, oh, these things just happen to some people, we don't know why. That's not true. We do know why. And we have the testing to prove it. We'll go in, we'll leave no stone unturned in determining the exact causes of your condition. Whether the causes be toxic nature, combination of toxic nature, infections, food allergies, adrenal dysfunction, blood sugar irregularities, nutritional deficiencies. These are the hidden roots of your condition tree. And these are where a functional medicine practitioner resides. Functional medicine is also not integrative medicine. It is not homeopathic medicine. It is not naturopathic medicine. It is not holistic medicine. Functional medicine is different from everything because it does not treat the condition or symptoms like all those others do. What it does is it treats the underlying roots. And if you have a chronic problem, believe me, you don't have just one of those. You've got several of those all working together and working against you as your conditions age right along with you. I want to thank you very much for watching. My name is Dr. Drew Duquette. If you have any questions at all, feel free to call myself or my staff if you have any questions, and we'll be happy to answer them. I want to thank you for watching. Have a good day.